Good afternoon. Today is Friday, May 15th. I'm Jim Weatherup, Chairman of the Oswego County Legislature. Joining me today are Diane Oldenburg, Senior Public Health Educator for the Oswego County Health Department, and Dr. Michael Stevens, Associate Chief Medical Officer of Oswego Health. I want to start by saying that we are elated to begin Phase 1 of the reopening process with our Central New York neighbors. It's been a long process and a lot of hard work by many people to reach this phase. I especially want to thank our Central New York neighbors Ryan McMahon, Paul Hyder, Eileen McNabb, John Becker, and Ben Walsh, my partners who make up the elected officials on the regional control room, as well as Mayor Michaels and Barlow, who have been very helpful. So what does Phase 1 reopening mean? It means that construction, manufacturing, agriculture, forestry, and fishing businesses can start the process to reopen. Retail businesses can apply to do business by curbside pickup. The state has specific guidelines and forms that must be submitted and approved for businesses to be eligible to restart. Let me say that again because it is very important. The state has specific guidelines and forms that must be submitted and approved for businesses to be eligible to restart. You can find this information and several other resources that may be helpful as you undertake these next steps on our website, www.oswegocounty.com. Phase 1 of reopening does not mean that everything is back to the way it was in March before all this started. New Yorkers are still required to wear a face mask and practice social distancing to prevent the spread of the virus. The governor's New York pause order is still in effect. From the governor's website, that means non-essential gatherings of individuals for any reason, meaning parties, celebrations, or other social events, are prohibited. Any concentration of individuals outside their home must be limited to workers providing essential services, and social distancing should be practiced. When in public, individuals must practice social distancing of at least 6 feet from others. Businesses and entities that provide other essential services must implement rules that facilitate social distancing of at least 6 feet. Individuals should limit outdoor recreational activities to non-contact and avoid activities when they come in close contact with other people. Individuals should also limit use of public transportation to when absolutely necessary and should limit potential exposure by spacing out at least 6 feet from other riders. Sick individuals should not leave their home unless to receive medical care, and young people should practice social distancing and avoid contact with vulnerable populations. We should continue to wash our hands frequently and follow the other precautionary measures that we've been using. The bottom line is, recovery and reopening will only work if we're able to keep the number of new cases down. If we become complacent, the closures and restrictions will be extended. Now Diane Oldenburg will give today's report on COVID-19 cases in the county. Diane?
Thank you, Mr. Chairman. As of today, 2,636 residents have been tested for COVID-19 or are scheduled to be tested for COVID-19. 80 residents have tested positive for COVID-19. 63 residents have recovered. We have 3 deaths in the county related to COVID-19, and we have 14 active cases of COVID. Total negative reports that have come back to the health department are 2,337. We have 213 test results pending. We have 203 residents in precautionary quarantine, and we have 78 residents in mandatory isolation or quarantine. As of today, 2,573 residents have completed and been released from isolation or quarantine. Thanks.
Thank you, Diane. Oswego County's partnership with Oswego Health has been invaluable in responding to COVID-19. Our guest today, Dr. Michael Stevens, will update us on what patients can expect during this reopening process. Dr. Stevens.
Thank you, Chairman Weatherup. I appreciate the opportunity to confirm and report to you and the community that Oswego Health remains prepared to take care of all the community health care needs in a safe and efficient manner. Your safety comes first, and that is why we've implemented all new measures and protocols throughout Oswego Hospital and our practices so you can feel safe as our community reopens. With very few instances of COVID-19 in our county, Oswego Health's facilities are by far the cleanest and safest facility in the region. Starting Monday, May 18th, Oswego Health will resume in-person visits in our offices and begin elective surgeries. We want to remind the community not to delay their medical care and reassure you that our facilities are safe, our staff is prepared, and we are ready to welcome you back and provide care. As the community reopens, all patients can expect that when they visit our primary care practices, specialty practices, our emergency room, and even our urgent care, that we will continue to screen for respiratory illness, continue to practice social distancing, and have limited waiting room access, as we will be utilizing a phone check-in process while patients wait in their vehicle when possible. With our urgent care centers in Fulton and Central Square, patients can continue to make an appointment in advance and check in online. In addition, of course, we are still providing telemedicine. We are resuming elective surgery starting Monday as well. To ensure the safety of our patients and staff, we are doing the following. All patients are required to be tested for COVID-19 prior to surgery. Also, with visitation still being restricted by the governor's order, Oswego Health has created a new team of surgical navigators that will assist patients and families throughout the procedure to keep open lines of communication. The navigator will meet patients and family in the parking lot of the surgery center at Oswego Hospital. The navigator will verify contact information for the family or support person so communication can continue. Patients then will be escorted into the surgery center for their procedure. Throughout the day, the team will continue to contact the family or support people as directed. At discharge, we will communicate with the family before the release. Oswego County is our community, and you are our biggest priority. We have ample personal protective equipment. We have ample testing. I am confident in the entire medical team at Oswego Health. We are ready, and we will care for all your health care needs right at home.
Thank you, Dr. Stevens. I again want to thank Oswego Health for their strong leadership and commitment to the public health. Oswego County will continue to do everything we can to keep our community safe and help our community through the restart process. If you have questions about coronavirus, please call the County Health Department's COVID-19 hotline at 315-349-3330. I encourage you to share these videos with your family and friends and refer to the Health Department's COVID-19 webpage for accurate and timely information about the situation in our county. Stay safe and healthy this weekend. We are getting through this together.